Hello, my name is Dr. Monette. I'm a psychiatrist, certified by and a fellow of the Royal College of Physicians and Surgeons of Canada. I obtained my medical degree at the University of Sherbrooke in Canada, and afterwards went on to be chief resident, then transferred to McMaster University Medical Center, where again I was appointed as chief resident. Thereafter, I've had 42 nearly uninterrupted years of psychiatric practice. For the past 12 years actually, my practice was limited to geriatric psychiatry and geriatric neuropsychiatry. I am now full-time practicing geriatric psychiatrist and neuropsychiatry physician at the Lake Haven unit here at Henry County Medical Center, and I'm a medical director of the Lake Haven unit. Since my arrival in January, I've enjoyed many referrals from a variety of referral sources, and so I do want to thank you all for the trust you have put in me, and also promise to continue to strive to respond to your demands for high quality care in my field. A little bit about me. I enjoy swimming. I enjoy my family life. I've recently, in the past years, been blessed with 2 grandchildren here in Tennessee that I adore and spend time with. And although I've abandoned my hobby, my favorite hobby, I'm planning to get back to it, and that is playing music. I've also joined First Christian Church, in which I've made a lot of friends and get a lot of support. And my wife and I enjoy the climate in Tennessee as relative to the climate that is too cold for us in Canada. At the time I became a psychiatrist, there were what we thought were wonderful discoveries in the field. I was there when antidepressant medications and antipsychotic medications were invented. The first antipsychotic medication in North America was brought by a psychiatrist from Germany, chlorpromazine, and Canada was the first to introduce antipsychotic medications. Then came down to the United States. In the United States, they call it Thorazine. And there were the antidepressants, MAO inhibitors and anafranil, and it gave an impetus to be able to treat patients in general hospitals and outpatients clinic rather than large mental institutions. So the field of psychiatry became feverish, and a lot of young doctors decided to go into the field of psychiatry. There were also innovations in the fields of psychotherapy, so at that time there was so much innovation, it presented a lot of interest. My interest up to then had been in neurology. It continues to be a very strong interest. I am a neuropsychiatrist. But I think my university was one of the first to boast the fact that they had a program where they could teach the relationship between mind and body and brain. And so psychotherapy was important. Brain chemistry and brain structure and brain physiology were important too, so it was fascinating. I have a lot of friends here. When I go up and down the corridors, I meet a lot of old acquaintances, always with a smile. I know there's some doctors here, like Dr. Richardson, from way back when I used to practice here. I've been back now since January after a stint in private psychiatric hospitals. People here are congenial. And it's my county, it's my city, and I know a lot of people here, and I have a lot of friends, acquaintances, and professional relationships that are cordial. I work with people like, to mention only a few, like Dr. Spinzig, For instance, it's very congenial. It's a lot of work because since my arrival in January, we've been favored, let's say, by an enormous amount of referrals. Very interesting cases. I see families from the community who, up to now, had been struggling with understanding what was happening with their loved ones, and see them, and they work with us. So it's not to say isn't at times stressful, because the cases are difficult, but overall, it's a very dynamic area right now. The other thing also, I enjoy responding to a need with the American population growing in age. The demographics of the American population growing in age, there's an extraordinary need and demand for services in geriatrics at large, and very much so in geriatric psychiatry. So I guess I put some importance in feeling useful, is what it is. But overall, that's why I enjoy working here. Well, my practice by necessity is limited now to geriatric psychiatry and inpatient. And a lot of people say, well, why can't you follow my mom? Or why can't you follow my dad on an outpatient basis? I know some neurologists in some clinics who do that, and I have to refer them out. Having established a relationship with the families and the patients here, it's hard to let go of. But I couldn't do both. It would be impossible. Right now, we are supplementing our staff, but we're on call every second day, and nearly every second weekend. That is being remedied. The call for work for me and my nurse practitioner is practically 6 days a week for the inpatient units when the units are full, and we have fulfilled these units so far. So there's no time possible for some rest and work on an outpatient basis, but as I mentioned to the administration, it would be real neat if we had an outpatient neuropsychiatric clinic with trained personnel that could follow. But I've been only here for 5 months, so we'll get there.